Good evening, everyone. October is Breast Cancer Awareness Month, as we all know. Uh, and we're at the end of October, but I think it's still a good time to remember that early interventions are important for breast cancer outcomes. And while we know this, there are still challenges that we face in India in terms of getting early diagnosis and therefore comprehensive treatment for patients. And most of the times breast cancer is detected at an advanced stage. So we will talk to a esteemed panel that we've put together and who will address this question over a series of questions and communication and conversation. So let me quickly introduce the panel, and some of them will be joining in a few minutes. We have with us Nandita Murlidhar, who's two times breast cancer survivor and a patient navigator in Chennai. We've got Dr. Joydeep Ghosh from Tata Medical Center in Kolkata, who's a medical oncologist. We are expected Dr. Aditi Thanki from Rajkot Cancer Society, Dr. Chirag Shah, Apollo Hospital, Ahmedabad, Dr. Pooja Babbar, CK Birla Hospital, Gurgaon, and Dr. Varun Goyal, Rajiv Gandhi Cancer Institute, Delhi. We are also joined by Dr. Neera Gupta, who's Senior Director, Medical Affairs at Biocon. And I'm Aparna Mittal. I'm the founder of Patients Engage. This panel discussion is supported by Biocon Biologics, and we are very happy and grateful that we have a panel which is going to shed light on this complex topic. A quick reminder to people who are new to us, Patients Engage is an online platform for patients dealing with chronic disease, and it allows patients and their caregivers to share personal experiences, information, and learn from each other. The important thing is that the better informed we are, the better decisions we will make. And also sharing makes sure that no one feels alone and they feel supported in this journey. Um, we've always put patients and survivors at the center of all of our conversations, and you can find a series of conversations on cancer care, which address relationships as well as medical information and supportive care on our YouTube channel. So you can head over and check that out later. Um, a reminder always that the views expressed in the videos are of the panelists and are only intended for spreading general awareness. They do not necessarily reflect those of the platform, and they do not replace a medical consultation. So please do consult your doctor or any of the doctors on this panel separately for a consultation. You can post your questions on Zoom, Facebook, or YouTube. We are live on the Biocon channels of Facebook and YouTube and LinkedIn, as well as on the Patients Engage Facebook and YouTube channels. So let me get started because we have with us, a lot of ground to cover. So let's get started with you. Dr. Pooja, thank you for joining us. If you're there, if you can turn on your video. Thank you. So Dr. Pooja, if you can start with just a reminder to the audience on what is breast cancer and what are the symptoms to watch out for.
So, breast cancer is a cancer that originates in the breast. Breast is made up of ducts, lobules, and the surrounding connective tissue. The cancer in the breast are of two types. Uh, the proper cancer is an invasive cancer, and other is in situ cancer, which is either DCIS or NCIS, which is not a proper cancer, but definitely it does require treatment in form of surgery and hormonal therapy, not including the chemotherapy part. And secondly, there are a lot of factors by which it is caused, and especially now the incidence is on rise. It is one of the most common cancer in India and in the world. And with the latest studies are showing that more and more, the number of breast cancer in younger age population is increasing, especially in India. Less than 40 years of age, we see now a lot of cases which we never used to see, or so that is one more thing. And with the urbanization, modernization, and the risk factors are also on the rise for especially for the female population. Late childbirth, late marriages, and hormonal imbalances, oral contraceptive pills, hormonal replacement therapies, and regarding the causes, so there are two
Yeah.
types of causes. One is modifiable, other is non-modifiable. Non-modifiable, we cannot do anything. It is by virtue of age and sex. So, and by virtue of your positive family history. And female, by virtue of their gender, are at a higher risk as compared to male. For every 100 female breast cancer, there is one male breast cancer. And as the age increases, the incidence of breast cancer also increases. On an average, woman is at a risk of 12% of having a breast cancer in the entire lifetime. And as this
Right.
age increases from 40s, 50s, 60s, 70, the risk of breast cancer also increases. And gradually, over the seminar, we'll discuss the other risk factor. What are the modifiable risk factors?
Thank you. Thank you, Dr. Pooja. Dr. Joydeep, if you can touch a bit more on, the modifiable risk factors, both in terms of prevention, what people can do, as well as risk reduction or secondary prevention. So if you can, shed light on that.
Yeah, regarding the modifiable risk factors, it's mostly, so if you look at the modifiable risk factors, they are mostly the usage of certain hormonal agents like diethylstilbestrol, although they are not much used nowadays. Of course, nulliparity is something that is nulliparous women have a tendency to have breast cancer. So,
So can I clarify for a layperson, when you say nulliparous, what does that mean?
yeah, I mean, and not having a kid in a woman's lifespan.
Right.
So having kids is good in one sense that it slightly reduces the chances, and of course, controlling obesity, because certain types of breast cancers are significantly associated with obesity. So keeping your weight under control is very important, and also we need to be aware
Hello.
of
Hi.
additional risks
Can you hear me?
Yes, Dr. Chirag, we can hear you.
Hello.
Thank you for joining. Yes, Dr. Chirag, we can hear you.
Yeah, so if there are certain risk factors, genetic risk factors or familial risk factors, then in those situations we need to be a bit more cautious, and we should keep a lookout of symptoms of breast cancer, and of course we'll be dealing with the topics of self-examination and screening at a later point. But yes, reducing weight. And reducing any addictions, avoiding hormonal therapies as much as possible.
Right.
These three, I would say, would be the most common modifiable factors that we can achieve.
Right. Thank you. Thank you, Dr. Joydeep. Dr. Chirag, thank you for joining us. We've just talked of what is breast cancer and what are the early symptoms and some of the modifiable risk factors. If you can talk to us about what are the best practices globally to improve early diagnosis, and what are the lessons we can take from there.
Right. So I think it starts with the patient's awareness first. So everyone talks a lot about the mammogram, but it is very important to have a self-awareness for women, because the test is, first it starts after age 50, and some guidelines recommend at 40 or at 45.
Correct.
So before that, now we know that the Indian statistics is showing that almost 40% people are diagnosed with breast cancer before the age of 50.
Right.
And a fair number, almost I think 25% as per the Lancet article, before the age of 40. So this is the age where we have not even started talking about mammogram. And there is no screening test approved for this age group.
Right.
So first is the being breast aware. And from the age of about 30, woman needs to start checking herself at least once in 2-3 months. We have to teach them the proper method. We have to also teach them not to do this every day. So many would do that every day, say, while I am in a bath, I check. That is actually wrong, because when we check every day, you don't notice a difference. So that is why it is important to do this every few months, or you could do it in a cycle as right after the menstrual cycle. So every month it kind of gets in the rhythm. Once in a year, you see a doctor as part of routine health checkup. So then again, it gets reinforced that whether you are doing it right way, and it is supplemented by the doctor's examination. So over the time, this awareness will set in, and what are the signs and symptoms. And then once you get to the age, then mammogram once in a year or once in 2 years, again differing guidelines. But that's the most important thing. I think the what the mammogram did internationally is created more awareness for breast health.
Right.
What mammogram has done itself is not as big as what it has done through awareness, because lot of the cancers are detected between the mammograms also.
Right.
But because people had a test, they started talking about it a lot. So awareness is very important.
Right. Thank you, Dr. Chirag. I will come back to the point you said about, routine checkup later, but I will first ask Nandita, you are a two-time breast cancer survivor. How were you diagnosed, and were you aware of, screening protocols, or did you do any self-breast examination before your diagnosis?
Yes, now one thing is I have a family history of cancer. So my mother, my father, a lot of cancer in the family. So we are cancer aware. But like Dr. Chirag said, I felt something. I went for a mammogram. The mammogram said no, nothing's there. And 3 months later, it was already 1 centimeter. And then I had come down to Cancer Institute in Chennai with my mother for her routine checkup. And that is how, like I told the doctor that I felt something, but they said it is not anything. But she did an FNAC and it was positive. So the mammogram had missed it. The mammogram missed it. I felt it while I was lying flat on the bed, face down. I thought something is on the bed. And so then when I saw nothing on the bed, I did the self-examination and I felt a small little lump. Now, later on, over the years, of course, I've come to realize, okay, the difference in, when you normally feel a cyst, that'll slip and slide. But with the tumor, it just stayed put. It felt rougher. It felt harder to touch. It didn't pain. I don't know if that is the way with all tumors, but in my case, it didn't pain. It didn't move. And the breast, like where the tumor was, in fact, instead of being out, it was like, in atta, suppose you press your finger in, a slight depression of sorts, like the mark you get if you press your finger into dough. So
Right.
that's
Right.
So
Right.
I detected it. I mean, I detected the thing and then went to the doctor and said there is something, and she did the FNAC and it was detected. Second time again, there was something. They kept on saying the mammogram. There are slight changes on the other side, and finally they did a PET scan, and it was again positive. I had insisted on a PET scan because of the sword hanging over my head. They said there are changes. There are changes. Maybe next 6 months later we'll check it. But my family couldn't take it. They said if there is a thing called PET scan and it can be detected, please go in for it. And sure enough, it showed up on the PET scan.
Right. Right.
Yeah.
Right. And Nandita, as a patient navigator, when you talk to other patients who've just been recently diagnosed or are suspected and need to complete their diagnosis, do you now find over the years? Are you seeing a greater awareness around self-breast examinations, or it's still a blind spot for women?
Oh, definitely, the awareness is definitely much more now, but the fear factor is the same as before. And we are dealing actually with people who just got the positive biopsy result. So we are actually just sort of softening the blow
Right.
by talking to them after they're told that, okay, go, it is positive, you have to go in for this treatment, just go and meet this person and go into this room, and then we deal with these patients. So basically, we are just softening the blow, because the first 5 minutes after you hear that positive thing is like it's like suddenly everything goes still, like you see in movies, everything goes in slow motion. You
Mm,
can't actually accept it. You're just sort of trying to absorb the impact. Immediately, you think of all the bad movies that you've seen. You think of Safar. You think of Anand. You think of all those movies. But
right.
first 5 minutes, if you see somebody sitting in front of you who looks perfectly okay, nothing is wrong, and then you realize that this person, and we tell them, look, we've gone through this, you'll be okay. It is a rough ride, but don't worry. So that's basically the thing that we tell them. Yes, everybody is scared to do the self examination. It is, besides, once you're finished with one, you are even scared to actually check the other side, because you don't want to know. You're actually scared to know that there is something else on the other side. But yes, the awareness is much more now. No
Right.
doubt about it. Huh?
Thank you. Thank you, Nandita. Uh, Dr. Aditi, thank you for joining. We're talking about, the options available for screening. We've talked of the breast self-exam. I think Dr. Chirag also talked of the mammo and the protocol for mammo. In your experience, what are the reasons you observe for delays in diagnosis? And I do want to also touch on, actually, before that, Dr. Chirag, one of the things we find is that while we are telling patients or women to do self-breast exam, the clinical breast exam is something which, unless there is some suspicion, is not happening, right? So uh, in some countries, for instance, if you go to a gynae for a regular checkup or for any gynecological problems, they will offer a clinical breast exam. We don't seem to have that, as far as we could figure out with our kind of informal surveys with people. We are not seeing that happening in an Indian context. Is there any and this I'm opening to the panel, is there any plans to kind of, and especially because younger and younger women are getting diagnosed with breast cancer, is there any plan to get gynaes to kind of offer, at least so that people know how to do the breast exam on their own, right? So if they do it once or twice, the gynae does it for them, then they know what needs to be done and they can follow through after that. Is there any plans or any discussions that are happening on the clinical breast exam?
So, the corporate health checkups, they do this part also, where they cover the uh, screening test for cancer, including the breast examination.
Mm-hmm.
What you are talking is a much larger missed opportunity, where when I was in US, the family doctor, the gynecologist, and the physician, all three officially do this as a part of routine health checkup at least once a year, and they formally offer it.
Mm.
So any one of these people you see by any reason, it would
Correct.
be offered. And it would be offered just like we offer tests.
Correct.
So you know, so they would offer, the same people would also do pap smear. Okay?
Mm. Mm.
Not just the gynae.
Correct.
All three would do pap smear also.
Mm.
So that way it was a much larger coverage provided. And I know that the government of India has done this as part of the CHCs, the community health centers examinations,
Mm-hmm.
now includes this also.
Okay.
So it is wherever, so in this one controlled field, you can say government healthcare, it
Right.
is now part of it
Becoming
and
part.
increasingly become aware. But 70% of healthcare about is in private sector,
Right. Right.
where it is very patchy and only as part of corporate health checkups, which are very few.
Very few. Yes, that's a very small percentage. Thank you. Thank you, Dr. Chirag. And as you said, it is a missed opportunity. Dr. Aditi, we've talked a little bit about screening and the risk factors. In your opinion, what are the reasons, or your experience, what are the reasons for delays in diagnosis of breast cancer in India?
So first of all will be, ma'am, the lack of awareness. The majority of our women are not aware of their normal breast. They are not aware of the changes in their breast. So many a times they are not coming up with the smallest of the changes in their nipples, in the size of the breast, in the shape, external appearance. They are not aware. And that's why we are stressing upon the importance of self breast examination here. I would just like to highlight one point that apart from the corporate check health, I'm currently working in a trust hospital, Rajkot Cancer Society. It is affiliated with a foundation, which is obviously it has a lesser coverage as compared to the government schemes, but they on regular basis are conducting these surveys, these awareness activities amongst the Saurashtra Kutch area. That is our local area where they are teaching and the women about self breast examination. They are also offering those who are willing to come to the hospital the free checkups as that is clinical breast examination as well as mammograms. So with those kind of awareness activities done with small trust based units also will be helpful apart from the government sector, which is definitely trying on their own at CHCs and PHC basis. The
Right.
second cause for delayed diagnosis is the fear, ma'am. Again, the stigma is pretty high, very common still in our population. Even if they are finding a lump in their breast, they are very fearful about getting it diagnosed. They hesitate. They come after 6 to 8 months many a times of the
Correct.
history is so long, and the initial presentation is that I just thought that because it is painless, it would go away, or it cannot happen to me. Cancer
Correct.
can never happen to me. If it
Correct.
happens, how the family will react, how the relations will react. That is another fear in Indian ladies we many a times come across. And that's why even after finding the symptoms, they don't reach the hospitals. These two are very common things, ma'am. And there is definitely some other logistic reasons, like they have in rural population also, when they don't have the facilities for reaching to the hospital, to the proper healthcare professional to get diagnosed at timely manner.
Right.
So that
Right.
requires infrastructure development at a larger scale. But as of now, I feel these in this are the three important causes of why we have a delayed diagnosis in our country.
Thank you. Thank you, Dr. Aditi. Dr. Varun, we talked of some of the challenges that patients feel, and I think this thing about it being painless and therefore people ignoring it is really very, very common. We've heard so many patients tell us this, that because it was painless, they didn't think it was needed to be taken seriously. And the other issue with other changes is that they're very uncomfortable talking about it to even their first family members, right? And therefore they can't take it further. So and I think Dr. Aditi's point that breast cancer doesn't happen to us, it happens to others. So even among the well educated, that's often a big issue, that we do all these awareness every year and they don't take it seriously, because unless you are somebody like Nandita, who's from a family of cancer history, most people think of it as it happens in others' families. So Dr. Varun, can you talk us through the process that patients typically need to navigate, and what are the challenges they feel from screening to diagnosis? And we'll come to post diagnosis, but screening to diagnosis, what are the process that most women will need to navigate, and what are the challenges they face in that?
So first of all, with the proper awareness programs and with the, I may say, we should remove social stigma associated with the cancer word, and so that they can discuss among themselves in the family, with their husband or their mother or someone else, so that they can go for further checkup at nearby center. Then, as Dr. Aditi have told that first care, like first जो center they will go, they should be aware of how to check clinical batch examination, and otherwise it may happen that they will go, but there they will just prescribe some antibiotic, and they can just without any checkup they can say that it may be just some boil and all. So there also there should be like a proper checkup. So as you have asked about the screening process, so obviously, first of all, clinical breast examination should be done. And it is not just breast examination. We should do whole body head to toe examination, physical examination. After that, according to age, we can offer mammogram, either X-ray mammogram or MRI mammogram. In the younger females, we can go for ultrasound breast. And if it looks suspicious lesions, and that is BRADS 4 or 5, then we should go for FNAC or biopsy for that. And then for staging process, we can go further for radiological investigation for the completion of staging. So this is mainly from screening to diagnosis, and then further navigation, like a type of tumor, and that for the treatment purpose that we can see.
Right. Dr. Joydeep, do we have any data on attrition after a diagnosis? Do people, after getting confirmed diagnosis, is there a lot of people who don't kind of start treatment soon? And is that percentage small, large? And again, what are some of the reasons for that?
Yeah, so we looked at our hospital attrition rates for all cancers, and the maximum was for lung cancer, but fortunately for breast cancer, it was around 30%. And when we tried to look at what was the reason why these 30% patients did not follow up, the majority of the reason were they wanted a second opinion from another center. And the second most common reason was they wanted to go for alternative therapies. Very few percentage of patients actually told us that they don't want to go for any treatment. That nowadays it's quite small, unless there is a significant financial problem or there is a significant logistic issue. Majority would want to get treated, but yes, alternative therapies do come into the picture, and many patients I have seen that with alternative therapies, they come back a year or so later with widespread metastatic disease, and then they feel very helpless. So that is something that we need to address, that the upfront alternative therapy is not the right way to go about for a breast lump.
Right, right. Nandita, in your experience as a navigator, because we've spoken to other navigators, and they do say that the biopsy is something that often patients are scared about or concerned about, and there are a few myths around that. Do you experience that in your discussions with the patients as well, or not as much now as well on that?
See, like one or two points that came up just now, they were saying the fear of, I think Dr. Aditi was saying, the fear of, of finding something. Once you find it, the reluctance to talk about it. In fact, we had a talk with Dr. Ramanan, had spoken to us recently at a support group meeting, where he said, wives of doctors, if you ask them how many doctors out here have had their wives checked up. He says, in a room full of oncologists, we all went silent. None, even our wives don't come up to us if they have a problem, because that is our official work. And no, this doesn't, and they're the same awkwardness that you're talking about in the common public. Even doctors' wives don't talk about it. So that is one stigma that you have to sort of remove. Then the what you were asking me about is that, yes, if once they come to know the biopsy result, there is a
No, I'm
fear.
saying even going in for a biopsy, is that still an issue?
Definitely.
Because we do find that we've had other navigators say that women are very reluctant to go for a biopsy.
See, like I'm with Dr. Selvi Radhakrishna, who's in Chennai Breast Center. So obviously, anybody who comes there has been actually referred by somebody else for a breast examination, for a biopsy, and for ruling out cancer, or either way. So normally, anybody who comes there does go in for a biopsy. uh, from the point of view as a common person, yes, the fear of actually detecting it is as much as the fear of hearing the answer, the fear of actually. So that one hurdle is there. The second major hurdle one finds faces is, of course, like telling somebody, like there's a young girl about 40 who's just going through her cancer. She said, I had so much on my hand, my parents, my in-laws, my kids are small. I knew there was something, but I thought it will go. And then I thought, okay, I'll go later. And finally, it's only after 6 months, when her husband forced her to, that she went for a checkup, and it was detected. And now she's had a mastectomy. She's going through chemo and all that stuff. But that fear of finding out, and once it happens, then, oh my God, what is going to happen? Who's going to manage this? That itself actually makes a lot of them not go ahead and start the treatment, come forward and start the treatment, or actually go in for the correct diagnosis, go to the correct person.
Right. Thanks, Nandita. Dr. Pooja, there's a follow-up question on the symptoms as well. There are sometimes, as even Nandita said, you wonder if it's just a cyst in the breast or if it's actually a tumor. So the question is that if it's a cyst at one time, does that cyst convert to a malignant tumor over time, or it's just a different incidents that happens?
So now these are under the classification of benign breast diseases. They are not malignant. And people do think that cyst over a long period of time does convert into cancer. And this is in the mind of patients who just come for other conditions, which is not directly or indirectly related to cancer. So there are a lot of other conditions in the breast. A simple cyst does not get converted into a breast cancer unless and until there are more other conditions like ductal hyperplasia, and they have certain atypical changes, and that they need to consult with a doctor, because if there is some chance of it being converted into a malignancy, excision is the choice of recommendation, which is upfront told to the patient. But just a simple cyst, a galactosele, uh, per se, it does not convert into cancer.
Okay, thank you, Dr. Pooja. Dr. Chirag, I think we talked a bit on the challenges of, for patients to navigate from screening to diagnosis. But if you look at it from diagnosis to treatment, or, kind of the treatment process, what are especially the changes that have happened over the last few years, both in terms of the positives and the negatives? So are there areas where things have improved? Are there challenges that we're still seeing?
So from diagnosis to treatment part, right?
So basically the treatment part, because we finished the diagnosis here.
So I think there is a very varied practice in India. So the place where I practice, being in the metro city and corporate hospital and all, the availability of the basic test ER, PR, and HER2 is very adequate and good quality. And many PET scans, many times even overdone, where it is not required for staging. But so I would say that getting the evaluation to start proper treatment is no longer an issue in the bigger city, and even with trust hospitals who would somehow connect with different places, with the larger government centers, with the one very big thing that has happened now is the government schemes. So earlier, the if you could not afford the treatment directly, then we did not have great options. I mean, we would tell them to go to the government hospital, navigate through some trust hospital, this, that, but there is a wait, and the systems are not very easy always. So now that is a very big thing. Now practically nobody is not affording. Okay.
Right.
So the newly diagnosed breast cancer, I'm talking about the person who is not in stage 4. For them, the standard of care is available regardless of your financial status. So the ones who don't get through that are the ones who are very uneducated, who don't even know that government is having some schemes, or they live far away and they have logistics issues. So in spite of that, knowing or having a government scheme card, they just don't reach, because like a farmer. So for a few months, there is a technical issue, I can't reach there,
Right.
or social support issue. So the big thing is that now, if patient is not affording, we straight away tell them, get the Ayushman card or whatever state, different states have different schemes, and get enrolled, and they get through everything. So that is a very big thing.
Right.
And that has improved the compliance of getting treatment a lot more. So, we talk about awareness and all those things are definitely important, but finance is, I think, by far the biggest factor. And as the more and more people go through this awareness of cost is not an issue will spread larger.
Right.
And that is a big game changer, I would say, in the last about 5-7 years, what I have seen compared to my first 15 years of practice.
Right.
And that's a very positive thing. Very positive.
Right. Right. And you talked of things like, the state schemes, Ayushman schemes. How good are these for people in the middle class? Because I think that's one of the challenges that still, I think second is, and I know you excluded stage 4, because I think still not affordable for, most of therapies are not included in most of these schemes. But in terms of the middle class, what is the kind of coverage that's available to them broadly? We're not getting into specific schemes, but
I think there's a misconception that for middle class these are not good, or even for stage 4 they are good. They cover the 95% of what is to be done based on the standard guidelines is covered. Okay? So the issue is with the 5% of treatment options. So in the stage 4, those become more talked about. Let's say not more important, because the outcome wise they are not much different. So the way I discuss with my patients is that it is like a regular Maruti car versus a Mercedes car. So you can get practically everything done with a Maruti, but if you always look at the best possible, you ask the best available, then Mercedes will come into play. So even the costing wise, if you look at it, in practically any field, 95% of the quality work is done at a X cost.
Right.
When you go from 95 to 98, the cost gets 3x. And 98 to 99 is 10x. Okay? So those extra axes are not included in the government schemes. But
Right.
otherwise, everything is possible. And now, because the government schemes are taken up by many private hospitals, it's not the same feeling as going to a very crowded government hospital where there is a long waiting. There is a very little waiting in most of the private hospitals. And then state-wise and scheme-wise, there will be some plus and minuses, but broadly, even for most middle class, this is now very good.
Right. Thank you. Thank you, Dr. Chirag. Dr. Aditi, we've got a question on what are the lifestyle changes that I need to make to ensure or to try and prevent breast cancer?
So, majority of the cases when we describe about the risk factors are about hormonal change. So when we say about early menarche or late menopause, that is not under our control. But nulliparity or those patients who choose delayed pregnancies or those who have obesity, those who have smoking and alcohol consumption to some extent, those who have been using oral contraception or basically hormone replacement therapy for a long, long time. Those are definitely associated with higher risk of breast cancer. So those are some of the changes which we can recommend by making people aware that these are genuine risk factors associated with breast cancers. Apart from that, uh, 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 a little bit less common, but exposure to radiation.
Right.
Uh, and if the patient has a family history of any of the genetic disorder or a significant family history of breast cancer or associated disorders like ovarian cancers, the regular screening. These are the things which we can definitely advise them in order to avoid or decrease the risk of breast cancer.
Right. Thank you. Thank you, Dr. Aditi. So, Dr. Joydeep, one of the non-modifiable risk factors are genetics, really. So, and there's a lot of talk of genetic testing, genome testing, etc. What is the role of that for someone who has some family history, is not sure whether it puts them at risk? What should they be aware of, and what action can they take to understand their risk factors?
See, most of the familial breast cancers, they have a tendency to affect individuals in the families, first degree relatives. And till lately, the recommendation for doing genetic testing in the patient were very clear, and they were like breast cancer in the first degree relatives, breast cancer in the patient herself, previous breast cancer, or somebody who has a male breast cancer, or somebody in the family having an ovarian cancer. So these were roughly the areas where we used to do genetic testing. But with the advancement of therapeutics, we have newer medicines which have come up, which are called the PARP inhibitors. So the newer trials are basically looking at the role of these PARP inhibitors. They have in fact been proven to be beneficial in those who have these genetic mutations. So since these therapeutic options have come up, the spectrum of testing has increased significantly. If not for the familial part or the genetic part, at least from the therapeutic perspective, we are testing patients who do not have family histories, but are of the higher risk, like the triple negative breast cancers or the hormone receptor positive breast cancers, where there is a role of these newer molecules. So I think it will be better if the patients discuss in detail with the genetic counselor, if available, that whether a particular patient needs genetic testing. There is no point wasting money in doing random genetic tests. It's specifically there are specific indications for doing genetic testing, and if they are followed, that would pick up majority of the genetic breast cancers.
Thank you. Thank you. Dr. Varun, we talked a little bit on the challenges of, and the fact that access and finance used to be a big challenge in terms of starting treatment or adherence to treatment, and now we've kind of, I think Dr. Chirag talked of how it's been addressed quite a bit. Are there other, psychosocial factors that you come across when you deal with patients and their families that you want to highlight as well?
So obviously there are many factors. First of all, obviously logistics and financial, which Dr. Chira already have highlighted. And for that, many healthcare schemes, government scheme now it is available. And with the generic drugs available, even mostly a drug like trastuzumab now are available at very cheaper prices. So that issue is we are tackling. But other psychosocial issue, as you have asked, like some patient just fearful for biopsy, because one fact is they don't want diagnosis. Another fact is some ask that if we do biopsy, if there is cancer, it will spread out. So this is also one of the most common question we have to answer, and most common query we have to tackle, that it is not the case. Without diagnosis, we can't get ahead. So that is one point. Another point is obviously body image. If we ask the female regarding mastectomy or maybe BCS and later mastectomy and later reconstruction and all. So there is a whole lot of issues regarding body image of the females, and most of the time females, even after diagnosis, as you asked about the attrition, that is the main reason of attrition. Regarding chemotherapy, it is not just cost, it is also side effect. And one of the most important side effect out of all is alopecia, because that is the thing that people surrounding neighbors and all, everyone can recognize that this patient is getting chemotherapy. That is, we can't hide that. And there are options about wig and all, but still. So all these are, and most and even after that, most important is that they want assurance, and they want in the like nowadays they want guarantee, and we can't give guarantee of the responses or survivals or so all these are a very important point. And
right,
regarding genetic test and so nowadays obviously still genetic tests are not that accessible, but obviously we can't do those tests in general public. Obviously if a female with TNBC or otherwise, if any family history, first test should be done to the index case. And then another another point is that we can't just ask for family screening without proper counseling, because if we do in a younger female, maybe just 16, 17 year, and then we'll do genetic test, and if that female comes BRCA positive, there is a like her whole life is upside down. And then every day, every minute, he will just scared of that, there is one gene mutated in her, and there is going to be cancer development. So all
right.
these points are also very important before prescribing any genetic testing and family screening.
Thank you. And before we go around to all of the panelists, Dr. Neera, from from an industry point of view, from Biocon's perspective, what do you think the industry can do to support early interventions?
First of all, thank you so much, Aparna, for giving us this opportunity to collaborate for this noble initiative. We are really privileged to be part of this webinar and the awareness session. So it's our aim to create such platforms wherein important authorities across the field, even bringing the patient perspective to create the awareness, is really something that we strive for. Also, there are certain newer molecules, biologics, that, for example, trastuzumab, that has been already discussed. So a lot of these biologics, they time, they have come into essential medicines. And still, in spite of being biosimilars being present, most of the peoples, they are still not able to afford it. So as global leaders in bringing biosimilars to the market across the globe, it gives us immense pride that we bring the affordable quality care so that no person is deprived of, and most of the patients, they are able to receive at least the essential care with the trust that the quality they are getting is as good as innovator, and they are going to get the improved outcomes with those quality medicines. So as industry, we really strive for this, and we bring the quality, affordable care and access, enhance the access to these medicines so that the patients, they receive at least the essential part of the treatment. Thank you, Aparna, for making us part of this important session. Thank you.
Thanks, Dr. Neera. Yes, Nandita, you wanted to say something? You're on mute.
Yeah, no, what Dr. Varun said just now, despite being educated, despite having a family history, the biggest hurdle was to say yes to mastectomy rather than lumpectomy. I kept on trying to tell the doctor, can't you just remove the lump? Finally, I agreed only on terms. I said, okay, you do a frozen section. That is, while I'm on the operating table, you check it out. If it is positive, then remove. That was the biggest hurdle to say yes to mastectomy. Second thing is also, yes, I've heard a lot of ladies saying, that the people, loss of hair. So many relatives and people around them start treating them differently, start treating them as if it's something that they can catch, that it is something that is infectious, that they may get it. So these are the two big hurdles that actually for a lady to get across. I mean, once the diagnosis has been done, to say yes
to
and
the
then,
treatment.
Yeah, and then to all the doctors here, I'd like to say that having a support group has made a world of difference to all the patients who come to CBC, for example. We are able to help them across that one very difficult hurdle. So it is a really good thing. I don't know if you people have it in your hospitals or wherever you're treating, to have a support system where somebody, a survivor, can talk to them is a big, big plus point from the point of view of a freshly diagnosed person. It's a good
and I think I would want to also highlight, I think the burden of body image is often put just on the women, but I think the burden is also on the family members and husbands who need to be supportive of those, body changes as well. That's one of the things we found by talking to so many patients, that it's something that, and even navigators like Nandita ji, who talk to so many of them, that it is something that even husbands need to be more supportive of. So, Dr. Chirag, your final words, and especially focused on early intervention and prevention as well.
Right. So first of all, thank you for this very nice program, and having a patient survivor is, I think, a very important difference in this meeting. It's a very different perspective provided by Nandita here. We have discussed about the importance of the breast awareness starting at young age, say around 30, because we are now seeing many younger patients. The government schemes and various options have now made a treatment very affordable, and of course, thanks to the generic medicines, high quality generic medicines, that many of the treatment cost is same as when I started or even lower now. So in fact, the post-operative chemotherapy for breast cancer costs less now compared to 10 years ago. So that's kudos to the Indian pharma. A very important point I wanted to highlight on the prevention. We talk about all the common points, but what has changed big time in last few decades and has been recognized by the International Agency for Cancer Research, the CDC USA, and various agencies is something we don't talk about. That is sleeping late and waking up late. Right? If you see the IARC website, night shift or altered circadian rhythm is put up there documented as one of the risk factors for various cancers, including breast cancer, with an evidence level of, I think, 2 or something. So, which is one is like tobacco, which is extremely strong, and 2 is where most of the other factors fall. So, this is something we don't speak about, which is a very easily modifiable and is a big one going around. And there are studies to also show, like the UK Million Women study, that those who wake up early have a less risk of breast cancer. And there is a biological rationale for that also. There less melatonin production if you sleep late. So that is one. Then other one is hygiene. Okay? The oral hygiene has been linked to multiple cancers, including breast cancer. So these are very simple tools, and they help in prevention of many cancers. So I really want to highlight these two, especially in the youngsters today, and practically everybody. Sleeping early is like an odd man out or an odd woman out, okay? Which should actually be a very important preventive strategy for many health problems, not just breast cancer. Thank you.
Thank you, Dr. Chirag. Dr. Pooja, your final words to the audience.
So I would like to tell everyone that see, it is the most common cancer, and it is the duty of all of us, not only the health officials or the doctors or the healthcare providers, but even as a general public or the breast cancer survivors, to spread maximum awareness about it, to encourage others to just undergo a normal screening, not to be fearful, to open up. And we also have to cater, one of the most important problem is social stigma. I have seen patients who have done biopsy, and because of slow doubling time in some of the cancers which are hormone positive, they come after 2 to 3 years. I mean, they are keeping that mass, and they know it is a cancer, and they have a diagnosis with them, but still they don't come, and it is all because of the social stigma. So all of us has to first make an effort to remove that, and that will make everything accessible. Everything is secondary now. Healthcare is a lot much improved. It is accessible, all the tests are available, everything is available, but to accept those tests, to understand, and then to normalize cancer is very important now.
Right. Thanks. Dr. Joydeep?
Yeah, for patients and I mean general public, my summary would be, if you have a breast lump, please visit your doctor and get it evaluated, because the chances of the breast cancer getting cured is almost to the tune of 90% if picked up early, but it is 0% if it is picked up at an advanced stage where it has spread to the body. So if you want to live long and love your family, please get the evaluation done as soon as possible.
Thank you. Thank you. Dr. Varun? Are you there? Yeah.
So just I may say some take-home message that breast cancer awareness is not just wearing pink ribbons on some special occasions. We have to know about the like process and how we should can do breast self-examination, clinical breast examination. All these we should aware of. We should unite in spreading awareness and should encourage regular checkup, because
Right.
we should spread that if we detect early, we can save life. So that's the main point.
Thank you. Thank you, Dr. Varun. Dr. Aditi?
So initially, when cancer used to be known as cancel, it is not a verdict anymore. I would just like to tell everyone that early detection and timely treatment can definitely cure more than 90% of the patients in early stages. So not to be afraid of. This is not something which you did wrong, so you had the disease. It was not probably in your hand to get diagnosed, but is definitely in your hand to get timely treatment and get cured. So early detection and cure will definitely get out of this stigma and the disease. There are wonderful treatments available which are very affordable now, with within reach of many of the population in our country now. So please take an advantage of that.
Thank you. Thank you, Dr. Aditi. Yes, Nandita. I
Sorry.
know you've been dying to say something,
No,
so
I want to actually, Dr. Chirag was saying that the things that we can do to prevent. Now, the latest thing that is that it is in your hands. It is the food we eat. It's the air we breathe, and it is our mental, the stress levels that everybody is going through, that all contribute towards this at some stage in some way. So the best way to actually get out of it is to change those basic things of what you're eating. Forget all these processed foods, and this, unfortunately, dairy is so full of hormones these days because the cows are pumped with hormones to produce more milk, and those hormones get passed on to us. Girls are coming of age much earlier than before, all because of these hormones which are actually going down to the children also. So the food we eat, our stress levels, how we control our stress. There are ways of dealing with it. The life has become so fast now. So controlling stress, breathing better, breathing deeply. We all do such superficial breathing. So these are three very easy things which are within our control to boost our immunity, to prevent further, to prevent further illnesses, and to help you recover from what you've already been through. I mean, I just wanted to add when Dr. Chirag, that's why I put my hand up.
right.
That's all I wanted to add.
Thanks, Nandita. Dr. Neera, any final words from you before I?
Thank you, Aparna, once again. So we are there in this fight against cancer, sharing, collaborating with each one of you, how to improve the outcomes by early interventions. So it's a journey that we need to lead together. Thank you so much, Aparna, and all esteemed panelists. It was a privilege indeed to be part of this esteemed panel. Thank you so much. Yeah, over
Thank
to
you,
you,
Dr.
Aparna.
Neera. Thank you, Dr. Neera. So I think, as it's very clear from our entire conversation today, that your health, our health is in our hands. So know your breasts. Make sure that you are examining them regularly and as per a particular cycle. It's not every day, it's once a month on the 10th day of your cycle. And move early. Whatever action needs to be taken, whether it's when you have a suspicion, when you've got diagnosed for treatment, and to comply with the treatment, at all stages, move early and do what needs to be done and take action, first of all, to reduce the risk of cancer. I think if we can avoid it, it's much better than if we have to treat it. So, but yes, it's not always avoidable. So don't guilt yourself. Don't think that you are to blame as well. So I think thank you to each one of you for contributing to this interesting discussion and making sure that we get the message out that early interventions can improve outcomes and of breast cancer. And let's all work towards that in the years to come. Thank you so much, everyone.
Bye.
Bye.
You
Bye-bye.
bye.
Thank you all. Thank you.
Bye.